A PSA test is a blood test that measures the amount of prostate-specific antigen in your blood. A raised PSA level may suggest you have a problem with your prostate, but not necessarily cancer. This is why it's not offered as part of a national screening programme, but you can request one. You may also be offered a PSA test as part of a general health check. There are advantages and disadvantages of having a PSA test, and it's a good idea to learn more about these before deciding to have it. There are certain symptoms to be aware of that can indicate prostate cancer. Always see a GP if you have any of the following: problems passing urine, such as needing to go urgently or often, or being unable to go at all, blood in your urine, pain when you wee, a urine infection, difficulty getting an erection,